Let's talk about sepsis and septic shock. Sepsis is defined as life-threatening organ dysfunction due to dysregulated host response to infection. Keywords here are organ dysfunction, host response, and infection. By that definition, we get a picture of a patient who is infected by a virus, a bacteria, or any other microorganism which causes the patient to deteriorate. Septic shock is a subset of sepsis, sort of a worst-case scenario of sepsis, where profound circulatory and metabolic abnormalities present, which causes increased mortality. Patient is on verge of death, so we must act quickly and provide critical care urgently. We should know when to suspect sepsis. There could be a clue in the history with a possible infection. For example, fever for 5 days. Or something like repeated vomiting. Usually the history is unclear and patient suddenly presence deteriorated. Especially the elderly. For example, patient gets drowsy, confused or develops shortness of breath. And on the initial examination can reveal low Glasgow Coma Scale score or low blood pressure. This kind of a scenario, especially of an elderly patient, is likely to be sepsis. There are scoring systems to accurately diagnose organ failure. SOFA score used in the ICU consists of lots of components. Q-SOFA score, or the quick SOFA score, is easy to use in bedside to assess organ failure. It uses 3 parameters:
GCS score less than 15, systolic blood pressure less than 100, respiratory rate more than 22. These values are suggestive of ongoing organ failure, and can be used to quickly diagnose sepsis in non-ICU setting. Diagnosing septic shock, which as above mentioned the worst-case scenario of sepsis, is done by either checking blood pressure, or measuring serum lactate levels, if vasopressors are needed to maintain blood pressure above 65 or persistently high serum lactate levels above 2 millimoles per liter. Despite adequate fluid, resuscitation should alert the physician about ongoing septic shock. Initial management of suspected sepsis. ABCD approach should be initiated immediately.
And assess any respiratory difficulties and give oxygen via face mask. Insert 2 large bore cannulas to veins. Connect the patient to cardiac monitor and if possible a catheter. First hour of sepsis or septic shock is called the golden hour. And septic bundle should be initiated. To lower the mortality. Fluid resuscitation immediately if hypotensive. Rapid administration of 30 ml per kilogram of crystalloids. Quickly draw blood. Get a venous blood gas. And measure lactate levels. Send blood for blood cultures and other routine investigations and measure capillary blood sugar levels. If high, insulin may be needed. Immediately start broad-spectrum antibiotics after taking blood cultures. Usually intravenous ceftriaxone and gentamicin combination is needed. Sometimes broader-spectrum antibiotics, such as meropenem or piperacillin and tocilizumab, will be needed. Get senior opinion on starting vasopressors. Vasopressors are needed if persisting hypotension below 65. Noradrenaline is preferred. Additional dobutamine may be needed. Preferably given via central line in ICU setting.